Hi everyone, my name is Dr. Esther Peterson and welcome back to another episode of What the Floss?
Don't floss, 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 floss.
So today I wanted to go over everything that you need to know as far as growth and development dentally goes for your children from before they're born, so when they're in utero, all the way up through age like 24. So let's go ahead and get started. There's a lot of information that I want to share with you. So moms and dads, when the baby is in mom's tummy and they're developing, growing, all that stuff, it's very important. You already know how important it is to have mom's nutrition really, really good. The reason dentally that that's important, that she's getting her prenatal vitamins, that she's getting her regular doctor visits, and that she's not getting sick is because the baby's baby teeth enamel are forming during those times. So even in utero, there's some dental development happening. It can, a pregnant mother's health can affect the amount of teeth that the baby has. It can affect all kinds of different things. So it's really important, moms, when you're pregnant, that you're staying on top of your prenatal vitamins, that you're getting your checkups and you're not getting sick yourself. We already know kind of the basics of that, but the dental application of that is the baby's teeth are developing while they're in utero. So they're getting little tooth buds of their baby teeth. So if you get a fever, it's going to affect their development. It can cause extra teeth to be formed. It can cause not enough teeth to be formed, and it can cause that weaker enamel, some different malformations that can happen. So it's important, even in utero, that mom is getting proper nutrition so that baby's teeth develop properly. Then when the child is born, really, they don't have teeth for the first 6 months to a year. Almost everybody gets at least one tooth right around 6 months. 6 to 9 months as their baby teeth are coming in. What I want you to do is take a washcloth and just wet it while they're having their normal bath, their nightly bath, and you're just gonna wipe off their teeth. They don't need a toothbrush, they don't need toothpaste. You're just gonna do a wet washcloth and just wipe their teeth nice and clean. And that's actually okay to do all the way up until they're about 18 months old. Once the baby has started to eat normal foods, and I'll go back to that point in a minute because I have a few tips for you there. But once the baby starts to eat normal food, then it's okay for your little toddler to start using a toothbrush. And what I want you to do is give them the toothbrush with just water on it and let them bite around on it. They're just going to chew on it, all that. And then you're going to follow up with your toothbrush, no toothpaste again. You're just going to follow up with a toothbrush and scrub their teeth nice and clean. So let's jump back to the comment that I just made about when they start eating solid foods or table foods. So in America, we are taught, and I did this with my 3 children, we're taught that as soon as they're able to swallow and we're starting to wean them off the bottle or off the formula, then we start to introduce things like rice cereals or things that we can pour into their mouth with a spoon. So there was an article in the Journal of Pediatrics that came out in like summer of 2019. And it talked about how Caucasian children in America in particular are having underdeveloped jaw muscles. And a lot of that, and also the kind of the roof of their mouth, their palate, that's super narrow, that causes airway issues leading to sleep apnea down the road when they're an adult. So what the Journal of Pediatrics said is that Caucasian children in particular who start using utensils too soon, and too soon meaning 6 months to 2 years old, they're learning a different swallow pattern. So as you're pouring that spoon of rice cereal into their mouth, their tongue is getting pushed down to the floor of their mouth and they're swallowing with their tongue pressed down. That's not where your tongue is supposed to go when you swallow. So when you swallow, say the letter N for me. Everybody who's listening to this, say the letter N. When you say N, feel where your tongue goes. It hits that bumpy part of your gums behind your teeth. Now hold that out and say the letter N. That is where your tongue is supposed to be when you swallow. So it's not supposed to touch your teeth and it's not supposed to hang out down at the floor of your mouth. So you can imagine when you're pouring the spoon of food in, that the tongue is getting pushed down, and that's how you're training your child to swallow. When the tongue doesn't go up to the roof of the mouth on the 2,000 times that we swallow every day, then your tongue is not pushing up on the roof of your mouth. It's not causing that natural expansion that we want to happen. We want nice, broad smiles. That's not only attractive in photos and on your Instagram selfies, but it's really healthy because the roof of your mouth is the floor of your nose. So you are actually expanding your airway and the amount of space, the surface area that your sinuses have and that your nose has to breathe. So that's the kind of training that I want you to focus on if your baby is 0 to 2 years old. So lots of finger foods, lots of things that they're going to self-feed, and so their tongue is able to go up and they can swallow correctly. Also, when they get transient colds or hay fevers or mild allergies as they're growing, make sure that you're putting like a Sudaflug or Vicks Vapor Plug or something, eucalyptus oil in your oil diffuser, something that's going to help them to keep their airway nice and clear. We want them, again, breathing only through their nose as they're growing and developing. Okay, so now we've covered birth through or pre-birth all the way through 2 years. From 18 months to 3 years old, there's a little thing happening, a very important thing happening. Your child's adult teeth enamel is actually forming during those times. So I heard when I was raising my kids that, if they have a fever while they're teething, it's normal, give them a little Tylenol. That's not normal. Teething does not cause a fever. A fever is caused usually by a virus that's going by. So it's very important that if your child gets a fever between 18 months to 3 years old, ear infections, things that cause disruptions in their breathing that compromise their overall health, it's really important that you keep that fever under control with either that ibuprofen or Tylenol, whatever your pediatrician recommends. So if their fever goes up over 100, then there's a disruption in that enamel formation of their adult teeth. So let's just say that 2-year-old Johnny has a fever of 102 for 3 days, and it's not coming down. It's not coming down. That is a virus. That's not because of his teething. So keep that under control with ice packs, with your medicines. Help him as quickly as he can to bring his temperature back to normal. If it's uncontrolled, then he will most likely have soft spots, super hard spots, discolored spots on his permanent teeth. And no parent wants that. You don't want their teeth to come in looking all janky, right? We all want pearly little white teeth. 18 months to 3 years, that's a really important time to keep their fevers under control. Okay, from 3 years to 6 years, I want you to bring them in to see me. Definitely bring them in as soon as they're getting their first teeth so they can play around on my dental chairs and all that. But from 3 years to 6 years, it's really important that I actually have a chance to look in their mouth. I can evaluate their palate, the things that we just talked about their swallow patterns. I want to see what their tongue is doing. I want to hear them talk. I want to know if speech therapy is going to be recommended for them. I want to know if they're a candidate for myofunctional therapy, which is the whole retraining of the oral complex, of the lips, of the tongue, how it all works together to help that growth and development. By the time your child is 6 years old and they're losing their 2 bottom front teeth and then ultimately their 2 upper front teeth, that's the important time that I need to see where their back molars are starting to come in. Right about that age of 6, their permanent molars are going to come in, and I want to see their eruption pattern to make sure the upper is going over the lower and locking in the correct spot. So lots of growth and development checks from ages 3 to 6 months. When they get to age 7, most children have completed 70% of their facial growth. So there's a lot that we can modify if we catch them from that age 3 to 6. There's a lot we can help. But if your child hasn't been into the dentist or a dentist who understands growth and development by the time they're 7, you're not at a loss. Bring them in. There's still a lot that we can capture between ages 7 to 10 because there's a lot of still jaw growth that can be capitalized on. We can still cause natural expansion. We can even use different aids if the natural expansion isn't adequate or going to be adequate. We can put in things like palate expanders. And palate expanders these days are so much easier than when I was a kid. It's not that crank, and they're in pain and all that. There are some that are still turning the screw, but it's a very gentle and slow movement that happens over about a 6-month period. The coolest thing about palate expanders these days is that Invisalign finally cleared their palate expander for children. So it's actually a series of Invisalign trays, and your child wears it for a week, and then they change out to the next one. And it's a very gentle, not having to turn the screw every night, very gentle way to expand their palate. So we have a handful of patients going through that right now, and you'd be surprised their compliance is actually phenomenal with this removable device. So that kind of covers ages 7 through 10. Now, if your child is 10 years old and now they're coming to the dentist for the first time, or a dentist who understands growth and development for the first time, and there's still not enough space, then there's a few other options that we can talk about, like an early intervention with braces, orthodontics. They might still be a candidate to be able to do that palate expander. It really just depends on their developmental age. So it depends how close they are to hitting puberty. And, we know boys and girls, they're very different. It depends on a whole bunch of factors: compliance, their ability to understand what's going on, and then, of course, the home care and the support that they're going to get at home from mom and dad. So when a child gets to about age 12 to 13, that's when almost all of their adult teeth are in. So the baby teeth are gone at this point. Adult teeth are in. First molars they get in at about 6 years old. Second molars they get in at 12 years old. So right about then, it's called 12-year molars. So you have all of your adult teeth, except for your wisdom teeth. Those are usually forming, if you have them, those are forming in the jawbone in the back. Usually we don't suggest having your wisdom teeth out until you're age 14 to 18, again, just depending on the development of those wisdom teeth. And that's something we can see when your child comes in and we take that x-ray that spins around their head. We can actually see all the wisdom teeth, if they have them, if they don't, where the location is. We also have the CT technology, so we can take a CT right in the office and have an exact placement and a photograph of what the development is of those wisdom teeth and make a recommendation for you from there. Children that need orthodontic intervention, they can do braces or Invisalign, and that best happens between ages 12 to 16. That bone is still malleable. It's still like moving through butter bone in a lot of cases. So the movement is a lot more comfortable. It's a lot more predictable. Those ligaments haven't solidified in their spaces yet. So when we move them into the right spots and then those ligaments solidify around the teeth, then they're going to stay there with less chance of relapse for the rest of your child's life. So if your child goes through braces while they're a teenager or Invisalign while they're a teenager, then they do have to plan to stay in retainers for the rest of their lives. So that kind of covers ages in utero all the way up through 16 to 18 when orthodontics is done. So the last segment that I wanted to talk about was that 17 through 24-ish. A lot of times what I see with 17-year-olds, they're young. They haven't taken care of their teeth. They have a big cavity that they've had when they were a child and they were 12 years old and they got their second molar in. It had a huge cavity in it. And now it's time to fix that cavity again because of things like still poor brushing, not enough plaque removal. They might maybe having acid reflux where when they're sleeping, they're spitting up a little acid and it's pooling on their back tooth and that's eating away the filling or the tooth. So then now they need to progress to something more permanent like a crown. So usually on developing children, and it's separate for girls and boys. If your little girl or your teenage girl needs a crown, then she's probably okay to get a permanent crown between the ages of 17 and 19. But if it's your boy, he's probably not okay to get his crown between ages 17 and 19. Same thing goes if they're missing a tooth and they need an implant. It's not okay for a girl to have it before she's 19. It's not okay for a boy to have it before he's close to 24. So it's only because of the growth patterns that come genetically with males and females. It's just a whole different pathway for each one. There's a maturity that's reached with females at an earlier age that is not there with boys until they're much older. So when we place something permanent like a crown or an implant, we want to wait until the majority of that jawbone growth is done. We want to wait till their bone starts to mature from that butter bone into something a little bit more solid and concrete, a little bit more dense to be able to hold those more permanent restorations. So ultimately, growth and development is a whole huge subject, and you can tell that I'm very passionate about it. I'm a Healthy Start provider. I'm an Invisalign provider. I've been doing orthodontics for over 13 years, so I love it. So if you have questions specifically, call me, text me, post questions on here. Let me know what questions you have, and I'll be happy to help. So until the next time, what the floss?
Don't floss, 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 floss.